has been developed.
I am confident that
key addresses and report on. I invite your attention.
And one vice chairperson.
for India.
Future collaboration in WHO.
By May 2026. In the same time,
Adenam, represent
The rest of participants.
If it is impossible, it's difficult. And start to exhale.
invite Dr. Katrina Boime, officer in charge of the WHO region office for Southeast Asia, to present the report.
Before the lunch will be served.
With a focus on nutritional support. Thailand, a global leader in digital health, developed. Sustaining these gains is not a choice, but a responsibility. For every life touched, there are many more who still wait for our support. Let us honor their courage by redoubling our commitment to health for all. Having said this, we must also recognize the shifting winds around us, the withdrawal of funding by some partners, and the shrinking of global development aid. All this reminds us that support cannot be taken for granted. These are not just numbers on a balance sheet. They are the difference between hope and hardship for millions. This is a moment that will test our resolve, a moment of both challenge and opportunity. Guided by your wisdom, we have chosen to respond not with hesitation, but with purpose. Rather than retreat, we have come together with you, our member states, to turn adversity into a catalyst for transformation. We embarked on a process of restructuring and realignment, not simply to adapt, but to build a foundation that is stronger, more resilient, and more inclusive than before. At the regional office and across our countries, we have abolished 30% of our staff positions and sadly had to let almost 80 people go. We realigned our workforce and developed organograms that directly reflect the priorities set by you in GPW 14 and in country cooperation strategies. Addressing priority risk factors for non-communicable diseases, as you have tasked us. Renewing our primary health care approach as the foundation for UHC. Strengthening health information systems and advancing digital transformation. Accelerating equity in access to quality health services. Improving access for all to quality sexual, reproductive, maternal, newborn, child, and adolescent health services, while tailoring services for older persons. Reinforcing preparedness, readiness, and resilience for health emergencies. And last but not least, ensuring the rapid detection of and effective response to acute public health threats. While our organogram aligns with the structure of WHO headquarters, it is rooted firmly in regional and country realities, maintaining global coherence, ensuring tailored country support. We have reviewed our workforce with an explicit lens on gender and geographical balance. This ensures, as it must, that our leadership and teams reflect the diversity and strengths of our region. We have maintained or aimed to maintain open lines of communication throughout, through town halls, regular updates, and honest dialogue. Because in times of change, transparency and trust are not luxuries, they are necessities. Most importantly, we have included you, our member states, at every step. Your input has shaped and owned this process. making it truly ours. With your support, we will now take it forward. Our approach is simple. Countries first for country impact. One example is that despite the massive funding cuts, approximately 80% of resources remain allocated to country offices. This safeguards country activities and ensures our ongoing on-the-ground support. As the Director General reminds us, these times that demand that we do more with less, making the best and most innovative use of our resources, sharpening our focus, and working together to deliver maximum impact. This is the path we're taking, deliberate and united, ensuring every investment delivers meaningful benefit. To achieve this, we need an operational plan with clear priorities, measurable targets, and a sharper focus on where WHO has the greatest comparative advantage. In other words, with our partners, mobilizing the sum of our strength while empowering those we serve, communities. This plan must guide us week by week, month by month, ensuring that every step we take truly delivers for our people. But a plan alone is not enough and will not be enough. In today's climate of shrinking aid and tighter budgets, resource mobilization is and has to be a shared responsibility. I see each of us as an advocate and connector, working together to sustain programs and amplify impact. And this is where our strength lies, in working together. Together, not just to sustain, but to accelerate disease elimination. Together, not just to improve vaccine coverage, but to expand protection across ever more diseases and among every age group. Together, not just to strengthen health emergency preparedness and resilience in countries, but to build a safer, more secure region and world. Together, to advance UHC, harnessing the best science and innovation for the most impactful results. Together for efficiency, and together for accountability. Because even in times of crisis, and perhaps especially in times of crisis, our mission remains clear: to protect health, keep the world safe, and serve the vulnerable. To strive even harder, even stronger, to realize every person's right to the highest attainable standard of health. Excellencies, partners and friends, let our operational plan serve as the great community meeting place, the banyan tree, a network of roots reaching wide, each one a contribution from member states, partners and communities. WHO is the soil that supports them, these roots, and accountability, shared commitment, and wise use of resources are the light that sustains the banyan tree's growth. A living symbol of community, of shelter, of resilience. A place where every voice belongs, where no one is left behind. As officer in charge, my promise to you is simple: to steady the ship, to speak truth as I see it, and to ensure our region moves forward with clarity and unity. I'm deeply grateful to the government of Sri Lanka for the hospitality, and to you, the member states of this region, for your shared purpose. One truth holds firm: when this region acts together, in solidarity, with resolve, with compassion, there is no storm too fierce, no drought too long. The banyan tree remains rooted. Together, let us do more than hold it firm. Let us grow. I thank you.
Immunization and essential service delivery. But beyond the statistics, what stands out is the region's focus on equity, reaching those who are hardest to reach, and addressing the social and economic barriers that keep people from care. The continued elimination of diseases such as lymphatic filariasis and trachoma, and the maintenance of the region's status as free of polio and maternal and neonatal tetanus speak to the region's long-term political commitment. Immunization campaigns in Bangladesh, Myanmar, the Democratic People's Republic of Korea are not saving lives now. They are investments in the future. And the integration of mental health and psychosocial support into primary health care marks an important shift. I am particularly encouraged by the region's commitment to transforming health systems through primary health care, digital innovation, and sustainable financing. More than 80% of countries in this region now have costed digital health blueprints, the highest proportion globally. From AI-assisted diagnostics in Thailand to integrated digital health records in Maldives, to Sri Lanka's transformation of its civil registration and vital statistics system, you are harnessing the power of digital technologies for health. The region has also made notable strides in universal health coverage, aligning reforms in health financing, workforce development, and essential services. These are not small feats. They are the foundations on which universal health coverage and trust in health systems are built. And even as financing pressures grow worldwide, as Katarina said earlier, member states in this region have shown that strategic investment, strong governance, and community engagement can sustain progress even in difficult times. The great challenge of our times is that health threats are becoming more complex and convergent. From the climate crisis, antimicrobial resistance, from demographic shifts to digital inequities. In response, countries are strengthening climate resilient health systems, developing national adaptation plans, and investing in green and sustainable health infrastructure, including climate resilient data systems in Nepal and the new World Health House in New Delhi, a model of climate responsive design. I thank the Government of India for its strong support for this new home for WHO's work in the region. On AMR, all countries in the region are now contributing to the global data platform. And your proactive participation in implementing the amendments to the international health regulations demonstrates your commitment to shared security. The integration of traditional and complementary medicine into national systems, guided by evidence and safety standards, is a uniquely regional strength. So too is the region's commitment to communities-driven health promotion, from healthy cities in Bangladesh and Thailand, to grassroots gender-based violence prevention in Bhutan, to youth-led mental health initiatives across countries. These examples remind us that health is never built in ministries or boardrooms alone. It's built in communities by people who care, who organize, and who act. The achievements in this region are a vital part of the global story of WHO and its partners. They show what's possible when countries own their priorities, partners align behind them, and WHO drives as one. As we implement the 14th General Program of Work and its sharper focus on promoting, providing, and protecting health, this region is already aligned with its priorities. you're charting a path that others can follow. One that proves health is not merely the absence of disease, but the presence of opportunity, dignity, and hope. Let us continue to work together to ensure that every woman can give birth safely, that every child can be vaccinated and nourished, that every adolescent can find support, and that every older person can live with health and purpose. As you know, WHO has been undertaking a major restructuring this year at headquarters and in every region, including this region. We began at the top, reducing the number of senior managers and directors at headquarters almost in half. We have now reached a milestone and are ready to move forward. I'm confident, as we do, we will do so with an organization at all levels that's sharper, more focused on its core mandate, and more able to deliver for member states and the people we all serve. Of course, with more independence as well. Honorable ministers, dear colleagues and friends, I leave you with 3 requests. First, I urge all member states to engage actively in negotiations on the PUB's annex to the pandemic agreement and to conclude it in time for next year's World Health Assembly in May. The pandemic agreement will not be complete without the annex. Second, I urge you to use every tool at your disposal to generate financing for health and improve efficiency as you build a more self-reliant future free from aid dependence, especially given the current ODA climate globally. WHO stands ready to support all member states to do that. And third, I urge you to seize this opportunity to work with us to build a stronger, more empowered and more independent WHO that's better able to serve all countries. We're considering the current crisis as opportunity, and we know WHO will emerge sharper, more focused on its mandate, more independent, and your guidance, your support will be very, very important. And I look forward to continuing to work with my colleagues in the regional office and with all member states as we work together to promote, provide, and protect health in Southeast Asia region and everywhere. Boham Istuti. Thank you very much. Thank you.